The invisible killer. No one could see it, and no one saw it coming the way it did. It was on December 31, 2019, when the first case of coronavirus was reported in Wuhan, in China. Coronavirus disease, or COVID-19, is an infectious disease caused by a newly discovered coronavirus and is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. From then on, the virus had swiftly spread among the other countries across the globe. India, the worst hit country at present, has reported more than 25 million cases and over 283,000 deaths, and at least 4,529 people succumbed to the disease over a 24-hour period. Same horror story of the COVID-19 is shared in USA, which still the leading place affected by COVID-19 with 581,000 deaths recorded. In Brazil, which is the world's second highest COVID-19 death toll after the United States and the third largest caseload behind the United States and India, had recorded a death toll rose to 430,417 recently after 2,383 more people died from COVID-19 in the past 24 hours. On the other side, Canada marked a grim milestone recently as the COVID-19 death toll had reached 25,000 and total number of cases stood at 1,336,275. With the continuous rising of COVID-19 cases, we could just not solely rely on our government to take actions to contain the virus, as we can take actions too, to help prevent the spread of the virus. Here are the following actions that we, as a global society, can take to mitigate COVID-19 spike in the world, more especially in the most affected countries like India, USA, Brazil, Canada, and other countries across the globe.
To mitigate the effect of COVID-19, the overarching goal is for all countries to control the pandemic by slowing down the transmission and reducing the mortality associated with COVID-19. The global strategic objectives are as follows. First, mobilize all sectors and communities to ensure that every sector of government and society takes ownership of and participate in the response and in preventing cases through hand hygiene, respiratory etiquette, and individual level physical distancing. Second, control sporadic cases and clusters and prevent community transmission by rapidly finding and isolating all cases, providing them with appropriate care and tracing, quarantine, and supporting all contacts. Third, suppress community transmission through context-appropriate infection prevention and control measures, population-level physical distancing measures, and appropriate and proportionate restrictions on non-essential domestic and international travel. The fourth objective, reduce mortality by providing appropriate clinical care for those affected by COVID-19, ensuring the continuity of essential health and social services, and protecting frontline workers and vulnerable populations. The last objective is develop safe and effective vaccines and therapeutics that can be delivered at scale and that are accessible based on need.
In order to mitigate COVID-19, we have to adopt strategies based on risk, capacity, and vulnerability. Every country must put in place a comprehensive public health measures to maintain a sustainable steady state of low level or no transmission and have the surge capacity to rapidly control cases to prevent community transmission from occurring. This approach needs to be applied at the lowest administrative level possible in each country to ensure a tailored and appropriate response depending on the situation and its capacities. Next, we have to have a strategic coordination for the production of global goods. Essential health commodities are global goods. The COVID-19 pandemic has led to an acute shortage of essential supplies, including personal protective equipment, diagnostics, and medical products. There must be a task force that will ensure that supply chains are driven by strategic and tactical health and medical priorities, and that the most critical gaps in supplies are identified and met in a timely fashion. Then, there should also be an intensive research, innovation, and knowledge sharing. So, acting now requires the public and private sectors to come together in support of a transparent and coordinated global process to pursue a research and innovation priorities for collective action around this common global threat. Enabling the greatest global good will require solidarity and collaboration, establishing sufficiently funded, collaborative, cross-agency and public-private partnerships, and facilitating open data access and information sharing.
Update technical expertise and health emergency workforce. As we have observed in many countries with the increasing number of cases, the workforce experienced their worst nightmare in responding to everyday scenarios. Those who under medical gowns are responsibly doing their best, yet still learning in some aspects they need to know. Experts in health emergency are in need to develop and update technical guidance for countries to prepare in response to COVID-19. Research protocols to address these gaps have been rapidly and transparently developed. Technical guidance is being adapted for different settings and contexts based on the intensity of transmission, the capacity of countries to implement public health measures, their available resources, and translate key actions required for each country. Avoid risk communication and ensure community engagement. The response to COVID pandemic globally has been accompanied by an infodemic, or the overabundance of information wherein some are accurate while some are not. This leads to misinterpretation where people can hardly find trustworthy sources and reliable guidance. This misinformation hampers public responses to epidemics and prevents people from taking adequate measures to effectively prevent disease transmission. We need to heighten our community engagement as well as delivering accurate information through multiple media channels to provide the right information to the right audience in order to ensure the right action from the global. A need for coordination and monitoring of countries' preparedness and response. The World Health Organization need to expand their involvement in the development of countries' response for COVID pandemic. They should monitor the measures taken by the government and private entities that impact the overall drive to mitigate the COVID cases and coordinate with significant organizations to trace all connections needed. Also, the unique scale of COVID-19 crisis requires the international community to reach out beyond its own capacity.
So, with the world facing an unprecedented threat, there is an opportunity to emerge with stronger health system and, and improve global collaboration to face the next health threat. It is important to keep in mind the breadth and depth of consequences already being felt across the globe. We must learn the lessons of this pandemic now, and in so doing, ensure that our response, whenever possible, leaves a lasting positive legacy and makes the world of the future a safer place.
In this time of pandemic calls for a collective action. We cannot do this alone, and that we need to work together as global citizens to mitigate the rise of COVID-19. Jointly leveraging our comparative strengths and respective voices to drive towards collective solutions to help mitigate the spike of the virus. We are stronger, faster, and more effective when working together. As what Chancellor Rishi Sunak MP said, and I quote, "We want to look back on this time and remember how, in the face of generation-defining moment, we undertook a collective national effort and we stood together." The key to end this COVID-19 pandemic is collective action, here, there, and everywhere.